Hi, my name is Oswaldo Luciano, and I am a clinical program manager in the Department of Nursing Education and Professional Development at the Mount Sinai Hospital. I am a cisgender gay male, um, and I identify with the pronouns he and him. Um, as a nurse educator, I am working on providing education to all nurses in the Mount Sinai hospital system that do not have experience caring for patients that are ventilated, as many of these COVID patients are. And one of the most humbling parts of doing so is being on the floor and seeing the angst and the sadness that many nurses are going through because of the pandemic. In addition, one of the most rewarding things about the pandemic is about the education that I'm providing is knowing that the education that we are providing is helping nurses provide best practice and to care for these patients uh, with the highest level of integrity and the highest level of knowledge that we can provide. So those are the things that I'm working out at Mount Sinai. Um, when the pandemic started at the beginning, I was a little bit more hesitant, and I was like, well, it doesn't look too bad, and things took a turn pretty quickly to for the worse. And that brought me right back to my beginnings. Before I became a nurse, I used to be um, working in the HIV non-for-profit world. I held a bunch of positions. I used to do support groups for queer people, for transgender individuals, for sex workers or LGBTQI sex workers, and basically underserved LGBTQI youth in Queens, Manhattan, and the Bronx. And I think one of the things I keep thinking about is that although COVID-19 is not affecting um, or well, it is affecting, but the mortality rate for young adults and youth is very low for COVID-19. But youth and young adults, especially LGBTQI youth and young adults, are not immune to the consequences as it relates to mental health and their well-being. We know that prior to the pandemic, LGBTQI youth were found to be a significant increased risk for depression, anxiety, social substance abuse, and suicidality. The risks are even more pronounced for non-binary folk and members of the transgender community. So social connections have been found to help with getting through this, and I think the social distancing and the unintended consequences of this physical distancing is a potential loss of social connections that protect LGBTQI youth from suicidality, from mental health, from depression. So that has been the thing that I keep thinking the most about when it comes to COVID-19 as it relates to the LGBTQI community. And it's the same thing happening to myself and my husband. We have two boys, a 4-year-old and a 16-month-old, and it's been difficult. It's been difficult not being to see friends, not being to socialize with friends, and for our children not to be able to go to their daycare program or their pre-K program. So those have been very difficult things. But with that said, there's hope for the future. And the hope is that, as wild and crazy and almost at times unbelievable as this has been, there's hope. And I think I am hopeful that things are going to get a lot better for everyone. I think many people are realizing the importance of connections and physical connections and checking up on friends and checking up on people. And those are the things that give me hope during this extremely difficult time. So, with that said, I want to thank everyone for everything that you do. Thank you for keeping as sane as possible during these crazy times, and in an effort to practice what I preach and social connection, you guys are able to find me on Instagram if you want, if you have questions, or if you want to just reach out to someone that might look like you, like myself, and you're welcome to send me a message. My Instagram name is nurse_o, and whatever questions you may have, if you just want to laugh, you'll see a bunch of pictures of my children. That's mostly what I post, and that has kept me sane throughout this crazy and trying times. Thank you so much, and hopefully this ends sooner than not. Thank you.